Good morning, everyone. Good morning. All right, great. So we will continue to have people slowly join us, but I do want to honor everyone's time and get started. So let's get this started. So welcome, everyone. We are so excited to have you joining us today for Workforce Support and Wellbeing. My name is Laura Liz Morales Silva. I am the Manager of Capacity Building at FPWA. This is the last foundational training of the fall. If you missed any of our previous sessions, please be sure to visit our trainings and resources page where you can sign up to watch every single one of our sessions on demand. You'll also be able to download our 2 free written resources, Trauma-Informed Service Delivery, Strategies and Actions for Working with Individuals, and Trauma-Informed Organization Checklist. I do see something in the chat, so just want to make sure that I don't miss anything. Great, thank you, Audia. And before we get started, I just want to go over a few housekeeping items. So first, we do encourage participation. Please use the Q&A or the chat functions for questions, comments, etc. And just to make sure that our chat is working properly today, please go ahead and introduce yourselves in the chat. Let us know who's on the call, your name, your role, organization, or just, anything you want to share with the group today. This session is being recorded and it will be posted to the FPWA website. So if you need to cut out a little early, just know that you will get a link in the follow-up email with instructions on how to access the recording. Again, you'll receive a follow-up email with that link and with the link to the post-session survey. So please do take those 2 minutes to complete that post-session survey after our training today. And please take care. The session might include information and discussion about trauma, so we always want you to be sure and take care of yourselves. And before we get into the content for today's session, we'd like to give a very brief overview of FPWA as an organization and highlight the ways in which we support the nonprofit sector. So FPWA is an anti-poverty policy and advocacy organization with a membership network of over 170 human services and faith-based organizations. We promote the social and economic well-being of individuals and communities by advocating for just public policies and strengthening the human services sector. As a programs team, our primary focus is on that last part, on strengthening human services organizations. We do that by supporting nonprofit and faith-based organizations in building their capacity to use a trauma-informed and people-centered approach to service delivery, organizational effectiveness, and civic engagement. So why the focus on being trauma-informed? Well, first, we recognize that nonprofit and faith-based organizations play an integral role in supporting the needs of individuals and communities. We know that they've been called on in the past, and especially in the last couple of years, to fill in the gaps where government might not always be able to support folks. And that's a very difficult job. We also know that many of the presenting needs of the individuals and communities coming to your organizations may stem from generational, interpersonal, systemic, and/or community trauma. For example, individuals may be coming to you because of food insecurity or housing instability. They may be coming to you for services related to interpersonal or community violence. These challenges and experiences are often rooted in trauma or toxic stress. We must address both the root causes. Oh, sorry. Oh, my PowerPoint is going crazy. We must address both the root causes and manifestations of that trauma in order to best serve our clients, our program participants, and our communities. FPWA is here to support you and your organizations in addressing those root causes and manifestations of trauma. So as a starting point, we are offering this core set of trainings and resources, these fall foundational trainings that are focused on trauma-informed and people-centered practices. And again, if you missed any of them, they are available on demand on our website. And finally, the why. We believe that taking a trauma-informed approach will result in a more effective and impactful human services sector that is best positioned to serve communities and to interrupt the cycles of trauma and poverty. In today's session, you will learn how you can actively promote staff well-being and improve your organization's response to the experience of compassion fatigue, burnout, and/or vicarious trauma. So first, we will hear from Piper Anderson from Create Forward on what it takes to establish the building blocks for a community of care and safety where everyone can learn, grow, and succeed in their roles. After that, we'll get a better grasp on the ins and outs of trauma-informed policies and procedures as Ivy Gamble Cobb from the Family Center walks us through their continuous quality improvement trauma-informed care project. And to close out the session, we'll hear from Sophia Hawley and gain insight into the benefits of Exhale to Inhale's trauma-informed organizational wellness programs. These are designed to enhance physical and mental stress reduction, agency and self-efficacy, and to support your team's overall well-being. We'll end the session with a short demonstration of chair yoga. Piper, Ivy, Sophia, we are grateful to have you be a part of this discussion today. Piper, over to you.
Hello, everyone. Really great to be here with you all. My name is Piper Anderson. I am the founder and managing director of Create Forward. Before we get started, because we are talking about such, heavy topics, right? Topics that many of us are living through and experiencing right this moment. I always think it's really important that we start with a moment of grounding. And so I'm going to invite you all to, wherever you are in this moment, find a comfortable position. And I'm just going to guide you through a very, very short grounding practice that I think could be a really wonderful tool to integrate into the way that you gather with your staff, right? At the beginning of gathering with our staff, taking a moment to co-regulate can make a huge difference in terms of our productivity, in terms of how we communicate with each other, in terms of how we are able to be present with each other and with our colleagues. So take a moment, if you can close your eyes, if you are someplace where you're comfortable enough to close your eyes, or you can just focus on a point directly in front of you and allow your eyes to be soft. And just start by putting your hand over your heart and your other hand over your belly. And take a deep, expansive breath, feeling your chest rise as you breathe. Exhaling fully. Inhale again. And exhale fully. And once more, inhaling and releasing. And just feel your heart beneath your hands. Feel your chest rise and fall as you breathe. Really bring your awareness to that hand and the connection between your hand and your chest. Notice any sensations in your body. There's no need to judge what you're experiencing right now or make a story about it. Just noticing and being curious about what your body is telling you right now. And just to yourself, just take a moment to name one thing that you are grateful for in this moment. One thing that you are grateful for. It could just be yourself. Grateful to yourself for showing up today for this conversation. You can release your hands now and take one more deep breath. In this time, as you exhale, imagine that you are releasing that breath through the bottom of your feet, hoping to root you to the earth. And on the next exhale, you can open your eyes and come back to the room. The quickest way to come back to the present moment is to pay attention to our breath. Notice our breathing. So just something to remember. Okay, I'm going to share my screen now. And you are very welcome. You're very welcome. I'm going to share my screen now and talk a bit about burnout. Now that we've grounded ourselves. Okay, I want to encourage you as we have this conversation, you may feel sensations in your body as you do, and just be curious, be open to whatever your body is offering you right now in terms of information. Maybe jot down some things like, okay, oh, that feels right. That feels like it's me. That feels like it's bringing up something, and you will have an opportunity to come back to it. So my name is Piper Anderson. As I said, I'm founder and managing director of Create Forward. We are a consultancy committed to delivering experiences that advance equity and justice. Our work is very much centered on designing experiences that orient people towards the kinds of communities and institutions that they want to live and work in. And we use a lot of storytelling in our approach because we feel like stories are a really relational tool to help people really bond and connect with each other, to see each other more fully, and to also to tune into what it is they want, right? What it is they value, what is it they care about. And that's what we want to create, right, in our institutions and in our communities, communities that thrive. So that is the work. So let's talk about burnout. I'm going to be talking about burnout from a very systemic perspective. So often our responses to burnout are individual, right? Someone comes to you and they're like, I feel burned out. And you're like, okay, well, learn to meditate or take a self-care day, which are great things. But the thing is that if there's one person in your organization who's burnt out, there are probably several. There's a whole team. There's an entire organization. It's never one person. It's usually lots of people. Some people don't even know that they're burnt out because they've lived in a state of toxic stress for so long that it just feels like the norm, right? And so it's really our responsibility to notice the signs of burnout within our teams, within our organizations. And if the systemic nature of burnout requires that we make structural changes to address it. So let's get clear about what I mean by burnout, right? So the World Health Organization refined the definition of burnout in 2019 and said that burnout is a syndrome resulting from a failure to manage workplace chronic stress. Chronic stress, right? So, when I'm talking about burnout in this presentation, I want you to really remember this piece around it being burnout is chronic stress, unmanaged chronic stress. The National Academy of Medicine, also in 2019, in studying burnout amongst healthcare workers, said that efforts to address burnout individually generally fail because it is a systemic issue that requires changes to policy, right? So that's how we're going to be thinking about burnout right now. The thing I want you to think about also is that a workplace defined by unmanaged chronic stress is an unsafe workplace. And here are the reasons why. So, when we think about burnout on a very individual level, these are some of the indicators. These are some of the things that we see in individuals: constant fatigue, anxiety, detachment, difficulty concentrating, lack of creativity, impaired immune system, right? Other things, empathy deficit, which, for those of you working in community service and social service agencies, empathy deficit is often a huge way in which you see burnout play out. No longer attending to relationships, right? So that means not being present with your colleagues and in meetings or in conversations, sort of checking out when it comes to having more, difficult conversations with folks, judgmental or leading with assumptions, no longer being curious or genuinely interested in the people in the room, and a lack of aliveness or lower or stagnant energy. Now imagine if this is a collective of people, right? Not just one individual experiencing empathy deficit, but an entire team or an entire department, right? An entire department no longer attending to relationships, people leading with judgment and assumptions, right? The impact of that is widespread. So when we see this happen within groups of people, it leads to a set of really maladaptive behaviors that become a part of the culture of work. So we have to address this on a systemic level. So Judy Ringer, who writes a lot about conflict transformation from an embodied approach, says we often hear it said that we cannot control others. And for the most part, that is true. We cannot force others to be the way we want them to be. But because we are in relationship with them, because we're connected, they will be affected by our choice to breathe and become centered. So I ask you to really center yourselves at the beginning of this conversation with the understanding that in doing so, how you receive this information, ooh, excuse me, how you receive this information will be different, right? How we receive information, how we hear the people around us is going to be very different if we arrive centered and present versus if we arrive flustered, frustrated, having already sort of had the argument in our head about what this person is going to say to me and how they're going to be a problem for me, right? So making the choice to breathe and become centered, making the choice to notice the symptoms of burnout within ourselves and address it can have a widespread effect on others. So in the chat, I'm curious, in the chat, would folks, I can't seem to open the chat for some reason. Oh, never mind, I can't open the chat. I was gonna say, invite you all to, in the chat, to write what a culture of burnout looks like to you. What do you think a culture of burnout looks like? So I can't see it right now in the chat for some reason. I don't think it's enabled, but in the chat, just go ahead and just, jot down what does burnout look like when it becomes sort of systemic and is a part of the culture of this space. So weird.
Piper, this is Adia. I can see it, so I can read some out to you.
Okay, great.
I see apathy, cynicism, binary thinking, tiredness, lack of performance, overload, mismanagement, not listening or reflecting. Oh, now they're coming in too quickly for me. Mentally exhausted, culture of blame, adjusting to new supervision, boredom, mistrust, lack of motivation, conflict-ridden, very reactive, making mistakes, sense of not having enough time, exhaustion. I'll stop there, but please do keep putting them in the chat. We can see them.
Thank you, Aria. Okay, thank you for those. Absolutely. And I think the biggest, at least in my work with organizations, one of the primary ways, so all of these things are absolutely indicators of like, systemic burnout and chronic stress. And one of the biggest things that I see, and I'm, in organizations will ask me to come in and work with them on, is conflict. Conflict increases. And a certain set of conflict avoidant behaviors become very prevalent within the workplace. Things like personal criticism, blaming, attacking the other person's character, personality, bullying, right? Rarely to their face, but to someone else. Suddenly this person becomes the villain, the enemy. Defensiveness, deflection, self-protection, justification, conversations about anything become sort of circular, and you can't really arrive at what's at the heart of what you're trying to resolve. Contempt, demeaning, mocking, disrespect, hostility, undermining and belittling, and then stonewalling, withdrawal or cutting off from communication, like not responding to emails or just avoiding conversations or just walking out of the room, silent treatment, avoidance. These are known as the 4 horsemen of the apocalypse in terms of conflict avoidant behaviors that become sort of the norm within a organization in which widespread burnout is present. Now imagine, like, we spend a third of our lives at work. Some of us more than a third of our lives at work. Many of us spend more time with our work colleagues than we do with our loved ones. And so imagine if this is the culture of how you communicate and you are in relationship with each other. A third of your life, right? And a third of your time throughout the week. So obviously you want to do something to address this. And, avoiding conflict only leads to more conflict. The Embodiment Institute really offers a really great reframing of what conflict is that I think is really valuable. We don't often hold reverence for what conflict is and what it is trying to offer us. Conflict really is an opportunity. Conflict gives us the opportunity to clarify boundaries, deepen relationships, and open potential for repair. Conflict is one of the primary ways that we change things, right? So if you are finding that your staff is like very much in a lot of conflict or avoiding conflict, I want you to sort of really think about it as an opportunity, right? Clearly there is something here that is just desperate to be named and to come to the surface that could lead to stronger relationships and an opportunity to address some of the causes of burnout within your organization. So what the Embodiment Institute is calling us to do is to take a more generative approach to conflict. So one thing about conflict is neutral. It is just our reactions that give it charge and lead to unintended consequences. So instead of resistance, we have to greet it with curiosity. Like, what is this tension that we're living with right now within the organization, really, giving us the opportunity to address. Conflict is an essential aspect of our authentic relationship. There's not a single relationship, an authentic relationship, in which conflict is not going to happen at some point, right? And if we trust each other enough to engage in conflict in a way that centers relationship, we can deepen trust and the connection between each other. Anybody who's ever gone to relationship counseling, probably knows this, but like what you hear, when you're learning how to communicate with a partner, it's like, do you want to be right or do you want to be in relationship? And the same is true with your colleagues, right? Do you want to be right or do you want to be in relationship? Because you can't have both, right? So we have to commit to centering the relationship within any of those conflicts. And that means often addressing some of the underlying causes of why people are in distress. Conflict cannot be resolved unless each party is willing to take responsibility for their actions, the impact of those actions, and then decide to change, right? So we all have to be called into change our behavior, once again, centering the relationship. And we must decide that the relationship matters more than being right. So lastly, just want to share, I have like 2 more slides. I hope I'm okay with time, Lattice. I don't know.
We're good. We're good.
Okay, good. All right, ways to enter into conflict. Um, Learning to tolerate your own sensations without judgment and practice staying curious. To be present in conflict, we have to stay in our bodies. So one way that you might learn to stay in your body in the midst of conflict is to do a stress rehearsal. So there's a dress rehearsal, but with relationships, it's called a stress rehearsal, right? So you can do a little bit of role playing with someone that you trust and say, okay, I have to have this really hard conversation, and I know it's going to be really triggering for me. So I want to practice it with you so that I can get used to feeling the sensations that come up and feel them and without judgment, and know that I'm okay, right? That the sensations that I'm experiencing are not an indication that I'm not safe. That I can tell the difference between when I'm just sort of like overwhelmed because I have a hard time addressing conflict and when I'm not safe, truly. I can trust myself to tell the difference. So, doing a stress rehearsal, cultivating a practice of giving and receiving feedback, and having direct conversations when issues show up instead of engaging in conflict avoidant behaviors, right? So, getting into the practice of feedback, mutual feedback, two-way feedback, that is like, intentional, that is consensual, and that is rooted in creating deepening relationship and resolving issues. Except that sometimes things will be left unresolved and or take a long time to reach completion because trust has to be restored. So we have to sort of get used to living a little bit in ambiguity for a while, because sometimes there are certain things that just require more time and space to address. And again, letting go of being right, focusing on identifying and addressing needs instead of judgments about the other person. One way to think about conflict is one, that it's neutral, and two, that conflict at its core is a misalignment of needs. That's it, a misalignment of needs. So getting clear about what is it that I need that's not being addressed in this relationship, and then being curious about what the other person needs that might not be addressed at that moment, and finding some place to negotiate so that your needs are met. So there's a lot more to say about conflict. This barely scratches the surface, but hopefully this is some valuable reframing that you can utilize. Last thing I want to share is just some examples of some of the ways that I've seen organizations address or try to reduce chronic stress. Things like limiting the number of meetings in a day, right? People get decision fatigue, you know what I mean? Like when you have back to back to back meetings, and that over time can lead to burnout. Create an agreement that we don't send emails after work hours. Now, this is a big one. People think that sending emails late at night is a victimless crime, but it is not, right? So part of what happens is that the cumulative effect of email happening late at night, right? So, for example, if I end the workday at 6 o'clock, but my supervisor is sending emails at 11 p.m. and some of those emails are things that I need to be able to do my job beginning at 9 a.m. I have no choice but to respond to those emails or look at those emails at 11 o'clock if I'm going to be prepared for the next day. So the cumulative effect of sending emails at all hours of the night is that people are working several hours outside of the workday when they could be resting, when they could be taking care of their families or doing things that are restorative for themselves, not thinking about work and worrying about whether or not their boss or their colleague is going to be sending them something that they need for the next day. Celebrate not working late. Create shared metrics for reducing chronic stress among staff. So having a conversation like, what are the sort of pain points that we could be addressing as a staff that would improve everyone's well-being over time, right? It could be a range of things. It might be that, one example is that like there could be majority of your staff might have children, and childcare is a major pain point for them, right? And so creating a childcare fund. There are like pre-tax, funds that you can set up for employees where you can contribute money towards the cost of childcare. Create buffers of time between meetings so that people have time to transition. I have a client right now where this is a very big one. They're a legal services organization, and there's a number of staff members who are working with clients who are experiencing, intense trauma and violence. And so they find themselves in situations where they are meeting with a staff, with a client, and trying to support that client and experiencing vicarious trauma as a result. And then they're, expected to end that meeting and go directly into another meeting without having any time at all to pause and just deal with the fact that they have just held all of this pain with their client. So buffers between meetings, particularly when you're doing heavy lifting, working with clients, allow people not to be on camera during meetings, right? Not being on camera is a vital way that people save mental energy. Provide health savings account to cover out-of-pocket costs. I have another client who's doing this right now. Finding culturally competent mental health providers is very challenging. Most of them are not covered within health insurance. And so they provide these health savings accounts to allow their staff of color to find mental health providers that are culturally competent. Designate one day where there's no meetings allowed, or shorten the work week. There's a lot of great research about the 4-day work week and how effective it is in reducing stress and improving overall employee satisfaction. And respect boundaries and reduce workload, right? These are big things. And I know that some people are like, well, we can't afford to do that. We don't have the resources. But if that might be the case, I want you to really think about the cost of turnover, because in workplaces that have high burnout, there is often, very, very high rates of turnover. So take a moment to do a little exercise, where you calculate the cost of turnover. Think about the cost of having to repost a job description, having to pull staff away to do interviews and review resumes, having to onboard that person, right? Imagine if you were able to reduce the cost of having to continuously hire new people all the time, how much money you would save by having employees who stay longer, who are more satisfied in the work, and who are less burned out and able to really enjoy their work. So a few thoughts, ideas about the systemic nature of burnout. If if this is something that you as an organization are, continuing to think about and want thought partnership, we are available to offer that kind of support. So I'm gonna end there and pass it back to Clarice.
Thank you so much, Piper. So much good stuff in our presentation. I will remind everyone, because I was wanting to take a screenshot. I'm like, oh yeah, we're going to share the slides. So we're going to share those slides with everyone so you can print that last slide up, have it there, ways that your organization can really help to decrease, I'm not going to say avoid, but decrease the effects of burnout in your staff and in your organization. Thank you. We do have one question. So I'm going to go ahead and ask if you have a direct, let me see, where did it go? Could you give an example of a practice of giving and receiving feedback in direct conversations that aren't just performance reviews?
So I have a protocol that I share around, regular feedback. I think particularly if your organization is straddling this kind of hybrid or remote work, environment, it can be very difficult to find natural opportunities to give feedback, because when we used to be in the office together, you could find that. It's harder to find now. So the first thing is consent, right? So asking permission, coming to someone and saying, listen, there's this thing I want to talk to you about. Being upfront about what the agenda is. Here's the topic. And, when would be a good time for us to have this conversation? Consent is key, because people need to be in the right frame of mind to receive feedback. So if you just show up and they're like, I got to talk to you about this. Okay, here's the thing, right? Like who knows, right? Who knows what their morning was like? Who knows if they are ready to receive it? But permission, right, gives them the opportunity to say, okay, you want to talk about this? Great. Can we do this tomorrow, right? Can we do this, at 3 p.m.? Obviously, we want to make sure that it happens within a reasonable amount of time, but consent is key. And it could be in that moment, but remember consent. Be upfront about what the agenda is. The next thing is be evidence-based, right? So, here is what I want to talk about. Here's what happened. And the impact of that is this, right? So you start with what happened, and then you talk about the impact on you, right? Or on the team or whatever. And then you give them an opportunity to respond, right? And you really listen. So giving feedback is not just about having your say. Again, this is a mutual feedback and it's about relationship. So you got to listen as well. So give them a chance to respond, and then together come up with strategies for change. You might discover in their response that there's something that you could be doing differently that could support them in accomplishing their goals. You can't, often, supervisors will just be like, I'm just saying, here's what you need to do to improve, without giving any consideration of whether or not that person is actually capable of doing it that way. Are you setting them up to fail by just giving them a list of things to do without considering their capacity, right? And so the collaborative nature of that sort of solution, process is really key to being able to move on from that, and without the person feeling kind of, just sort of powerless and frustrated. But, finding time, asking consent, being clear about the agenda, making it a conversation, and about like working together to find a solution.
Oh, super helpful. Thank you. Yeah, I highlighted when you said, the importance of having regular mutual, intentional, and consensual feedback. I'm like, yes, all of this. So important and not done enough. So thank you so much, Piper. All right, so let's continue this awesome conversation. Yes, we will share the slides. Yes, we will share Piper's and everyone's contact info so you can reach out to them, have them speak at your organization. So here we will now move on to Ivy. Thank you, Piper. Let me see if I can start sharing. Give me just a second, everyone. All right. And let me see if I can spotlight you. Ivy.
Awesome. Good morning.
Great. You can see the presentation. Awesome.
I can. Thank you so much for this opportunity to be here. And Piper, thank you so much for your presentation, because much of what you shared is what we were seeing in the Family Center, and why we decided to take on this CQI project specifically around becoming a more trauma-informed care organization. So thank you for setting the stage for that. So I just want to share a little bit of history around the Family Center. So next slide. So we are a 28-year-old organization. We started at the height of the HIV epidemic. And when we started, our mission was primarily focused on assisting parents who are living with HIV and AIDS and creating future care plans for their minor children using a multidisciplinary team model where we had a case manager, a social worker, and an attorney working together. We recognized that this model that we had created would be applicable to working with families, not just impacted by parental illness, but any crisis or loss that caused the family to need some additional supports. Next slide. So this is just a summary of the services that we are providing. We operate both in Article 31 mental health and in Article 32 substance use clinic. We offer specialized services for caregiver-headed households and support for families impacted by HIV and AIDS and cancer. We have a full service legal department where, in addition to the future care planning work that we continue to do, we assist families with advanced directives, family law issues, income maintenance, public benefits, and housing. We continue to we now offer training specifically around working with older individuals who are living with HIV and also persons who are living with Hep C. Next slide. So who are our clients? We're serving some of the most marginalized and under-resourced members of our community. These are just some of the demographics of the families that we serve. What's interesting is many of these families report, both for adults and children, at least one traumatic event in their lives. And in most cases, multiple traumatic events. And very often we find that many of our family members score moderate to high when we're measuring adverse childhood events. Next slide. So why do CQI around trauma-informed care? The Family Center is committed to providing trauma-informed care across all of our programs, our units, and our departments. Trauma-informed care is an approach to delivering services that recognize the prevalence of trauma and its many effects and seeks to create an environment that encourages resilience and minimizes the potential for re-traumatization. Our goal was to bring all of the Family Center priorities, protocols, and services into alignment with trauma-informed best practice guidelines, and to develop an agency-wide process and structure to serve as the ongoing framework within the agency so that we could make sure that we were continuing to work on improving agency operations using a trauma-informed lens. Next slide. Now, these are some of the benefits of adopting a trauma-informed approach. And so we know that there are many, but we were specifically looking at adopting principles that directly impacted our most important resource, our staff who provide the direct service and support the provision of direct services to our consumer base. I often say that there is a direct correlation between how staff feel that they are or are not taken care of and how that is reflected in the quality of services that they are providing to our constituents. As the executive director, I should have little expectation that clients are well taken care of if the staff do not feel that they are well taken care of. Next slide. So what were some of the key steps to us starting this work? The first step, and really a very crucial step, is making sure you find the right partner to work with, and that you agree with this partner on what the agenda is going to be for the engagement. This work requires a huge time and financial commitment. And so you have to make sure that it's a good fit in terms of the partnership. You have to look at creating your internal team, your trauma-informed care champions, those who see the benefit to the agency and want to take a more leadership role as we move this agenda forward. And because staff may be at different places in their knowledge around trauma-informed care, you have to build time in to ground everyone in the basic principles. Next slide, please. So after extensive research, the Family Center decided to work with the National Council for Mental Well-Being. And one of the first things that we did was made sure that we were in agreement in terms of the priorities that we were setting for our work, that we wanted to identify areas for improvement based on an organizational self-assessment that we were going to do, that we wanted to develop a continuous quality improvement infrastructure that would be used to help us prioritize the projects that we wanted to take on that came out of the organizational self-assessment. And we wanted to engage staff in committees and work groups directly related to the CQI project, and that we knew that we needed to continually assess the process and make changes as necessary. Next slide. So what did we do? Once we had selected our partner, it was grounding everyone in the work. And so for our kickoff, we had a 2-day event where we closed the office. We went to an offsite location and all staff participated in a training on trauma-informed care so that we were all starting in the same place. On day 2, we brought together our trauma champions who would be key to moving this process along. And what was key about this, and we call this our core implementation team, was that we wanted to include representation from every area of the organization and at all levels within the agency. Next slide. So our organizational self-assessment. So this served at the core for us in terms of looking at current agency practice. We surveyed all of our staff and other community stakeholders. This data was analyzed by our partner and then brought back to our core implementation team. And I have to say, not all of it was positive. There were some real eye-opening feedback that we received from our staff. And as the executive director and as one of the founders, you know, very often it's hard to receive that challenging feedback. But if we were really going to move this process along and wanted to see change, then we had to ask our staff to be really brave in terms of sharing their feedback. And then we had to be open to receiving that feedback, whether positive or more critical. It was a self-reflective process that allowed us to identify what we wanted to keep doing and reinforcing, what we needed to stop doing, and lastly, what we needed to start doing. Next slide. So out of that organizational self-assessment, there were 7 domains of trauma-informed care that were identified. Specifically for this presentation, we're going to be talking about those related to workforce support and staff well-being. And those were supporting a trauma-informed, educated, and responsive workforce and creating a safe and secure environment. Next slide. So what did we learn from our OSA about workforce support and well-being? And these are some of the actual comments that we received from our staff. How best can we integrate trauma-informed principles in our day-to-day work, not just using trauma-informed language, but ensuring that our actual practices, protocols, and principles represent that? How best to balance the needs of funders around the collection of very sensitive data with the engagement process and rapport building that needs to take place with clients? Caring for our caregivers. What resources is the agency offering to staff working with traumatized clients to prevent burnout and secondary trauma for the practitioner? Laura Lise, you can just hit enter and the other comments will show up. Thank you. How to ensure that all staff members from the front desk staff to the actual clinicians are trained in trauma-informed practices, and how best to create an environment where staff feel safe and feel supported. Next slide. So diving into the work, now that we had the information from the organizational self-assessment, it was time to dive into the work. And so we decided to select 3 domains from the 7 domains identified to start. You cannot do everything at once. You have to set priorities, and we elected to focus on the areas that affected our 2 key constituents, our staff and our clients. Next slide. I think we may have skipped the slide. There we go. So what were some of our accomplishments in terms of workforce and well-being? So some of the major outcomes of this work is we increase opportunities for staff at all levels and our clients to provide feedback and to participate in conversations and decision-making on various issues. And we use surveys, we use full staff discussions, we use work in committee to move these conversations forward. We have received feedback that supervision was not consistent across the agency. So we created a vision statement around supervision and clarified expectations across the agency around the supervision process. We revamped our new staff orientation process and content, not just to add content on trauma-informed care, but to also ensure that new hires across job functions and teams got consistent and thorough orientation to agency culture, values, programs, and policies. We created what we call Goodie Fridays to address departmental silos by developing opportunities for staff to socialize informally in ways that promoted more cross-departmental interactions. We brought in a management consultant to help us redesign our employee development and performance management process. We created core competencies for all staff and became more transparent around the performance evaluation process, including making a greater connection between individual goals, departmental goals, and overall agency goals and how they all tie together. We looked at our health benefits and were able to offer expanded benefits and more offerings for staff that were not cost prohibitive for the staff member and for the agency. We reintroduced our employee assistance program, and recently we looked at more ways to tangibly recognize staff retention. Within safety and security, we created a safety and security manual and updated and trained all staff on emergency management protocols, including staff and client safety protocols. As we dealt with the pandemic, we applied a trauma-informed framework as we introduced new rules for clients and staff related to the pandemic. This informed the rules that we put in place and, more importantly, how we communicated and enforced these new protocols. Next slide. With this work, there is always going to be challenges and barriers to implementation and to sustainability. And so these are some of the ones that we confronted as we dealt with this work. One of the major challenges as you begin to identify changes that you want to make is the actual financial costs of the changes that you're looking at, especially as it relates to workforce and well-being, because very often these changes cost money, both in actual costs or when you're working in a billable environment, the time not seeing client means revenue loss for the agency. So finding the right balance is very complicated, but it's something that you have to take on. Next slide. So where are we now? We started this work in 2017 and it continues. And as we all know, life continues to happen while you're doing the work. And while we were doing the work around trauma-informed care, we all were a part of and saw the racial unrest that was happening across the country. And it required that we needed to take on combating racism and its impact on how we do the work, how we talk about it, and how we message around our work. So similar to the process that we took on for trauma-informed care, we needed to do a similar process around diversity, equity, inclusion, and accessibility, and figure out how to merge the two. So what we did was we took our standing trauma-informed committees and we looked for where was the overlap with the domains that were identified in our racial equity plan. And we combined committees as we move forward to address the remaining domains identified in our trauma-informed work. Next slide. So what are some take-home points that we learned through this process? You can't let up. You have to keep moving forward. And you should expect that there is going to be a dip at various points in the process. You can't get discouraged or distracted by that. You have to keep moving forward. You have to remember this is a marathon, not a sprint. It's not going to happen overnight. You have to be in there for the long haul. Celebrate every success. It doesn't have to be a huge success for you to celebrate, but those small incremental successes are really important to keeping the momentum and the motivation moving forward. Continuity is key, and we knew that this was an issue, especially if we all have dealt with the Great Resignation. And so as we took this on, it was really important for us to ask our participating staff to commit to this work for at least a year. And we encourage staff to be a part of the change that they want to see. There's no sitting on the sidelines and watching what's happening. You have to be a part of it. And as the agency head, I needed to create the atmosphere for staff to be able to do this and to be willing to take part in this process. And I think that is my last slide. So yes, so thank you so much for this opportunity to share the work that we've done at the Family Center, what we've learned, and just know that this is a continuous evolving process. We've been doing it for the last 5 years, and I anticipate that this is work that we are going to continue to do as we move forward. Thank you.
Thank you. Thank you, Ivy. Thank you for your honesty, first and foremost, for letting it, you cannot do everything all at once. And so I think it's really important that you highlight that and highlight the fact that you need to prioritize, and that in that process, you listened to feedback, you actually took action on that feedback. And a lot of that was related to items that directly were impacting your staff. You were asking the organization to be more trauma informed, but you, in the process, worked on being more trauma informed with your staff. So those areas that you really focused on that impact staff, supervision, really setting new expectations across the board for all supervisors. I think that's something that a lot of our organizations would really benefit from. Performance reviews, taking a look at those old performance reviews and making sure that they are not missing the mark. Those safety protocols, onboarding, taking a look at your benefits. I think that was all, really, really important, and also being responsive. So yes, you have this whole huge project you're working on, trauma-informed care, but also being responsive. Life does continue to happen, and you need to show your staff that you're listening to what's happening out there, out in the world. And so reshifting and really being attentive to that, I think is so important. So thank you for talking us through that whole process. Amazing.
Thank you. My pleasure.
All right. If we don't have any more questions, and I don't see any in the chat,
Sweet.
I think we'll move
Lois,
on. Yes.
could I throw one
Yes.
question out?
Go ahead. Yeah.
Um, I, Ivy, something you said that really caught my attention was, having staff be a part of the change. And I think going back to what both Piper and you said, sort of a signifier of burnout is disengagement, and maybe even apathy.
Mhm.
So, especially as the leader, how do you start that process of engaging or re-engaging staff when they may be already burned out?
You know what? It's really having those honest conversations with staff around where they are and trying to strike a balance. I think Piper talked about that as well. It's having those honest conversations. The work has to be done. And what I say to staff is we have an obligation. Whether it's a grant or a contract, we agreed to take on this work. How can we best do it in terms of meeting the needs of the clients that we're charged with serving and the funder who has trusted us to provide those services, but at the same time, recognizing the work that's being done. And so really having honest conversations. We talked about caseloads. That's a huge issue. We've talked about performance measures and different aspects of the work, but it first begins with communication, because if you don't understand or know exactly what the issues are, then how can you really address them? And so communication is key. And I have to say, for me as the executive director, especially as we did the organizational assessment and we got a lot of that feedback, it was hard to sometimes sit in the room. I mean, and hear that this is an agency that I founded 28 years ago with 3 other women. So it's my baby. So it was pretty hard to hear some of the critical feedback, but I needed to sit there. I had to sit there. I had to hear it and I had to respond to it. And it wasn't about me. It wasn't about taking it personally, but it was important for me to hear both the positive feedback and, more importantly, the critical feedback.
Thank you.
Yes. Thank you so much. All right. Thank you for that. Amazing. Now we will move on to Sophia. Sophia Holly from Exhale to Inhale. Let me see if I can spotlight you here. All right. There we go.
Great. Thank you. Thank you, Laura Lees, and thank you so much, Piper and Ivy. I feel honored to be part of this amazing training and excited. Sometimes I get nervous going last, but excited to have been going last because it's such a beautiful introduction and relates so much to the work that we do at Exhale to Inhale. So again, my name is Sophia Holly, and I'm the Director of Community Partnerships at Exhale to Inhale. And we bring yoga right on point to survivors of domestic violence and sexual assault. Specifically, our mission statement right here is that we use the healing practices of trauma-informed yoga to empower survivors, while also helping communities to develop the skills and knowledge to support them. So that means that we offer classes online and in person to various other nonprofits. We're a nonprofit ourselves, and domestic violence shelters and other organizations that serve survivors. And we also support the staff specifically through trauma-informed yoga and also through trainings. And I'd like to highlight here, this is a training today for you all, that we also have an organizational wellness program. And so because yoga it's an old practice and it can be healing for many individuals, we found that our methodology is also healing to individuals who work with anyone. One way we describe trauma-informed yoga is people-informed yoga, because trauma is something that many people do experience. And so on the next slide, just sharing a little bit more about our background. So 2013 is when we were founded, and I can't believe that's almost 10 years ago, but here we are. And since then, we've empowered over 6,000 survivors through this healing practice. Our approach helps survivors reconnect with their own bodies and inherent strength so that they can better navigate the challenges that they're experience. So with that, this approach can help anyone navigate experiences that they're challenging through work or life, or those two things combined. And so on the next slide, yeah, just a little bit more about our impact. So this year, we served over 50 nonprofits and community partners. And so we're just honored to have to continue to grow. I think when I started, we had about 20 organizations that we worked with. So slowly but surely expanding. We've been able to expand our reach a little more through the pandemic because some of our offerings are accessible online, a lot of our offerings, which has been exciting. So this next slide, kind of just jumping right in, and I'd like to just pause for a moment. You're welcome to view this slide, but what to expect in the next 20 minutes or so, a little less than 20 minutes, is I'm going to share a little bit more about why we use yoga for healing and how that might relate to the work that you do or to your own self-care. And so I'll continue to go through my slide deck, and then we will end with a 5-minute mini meditation / chair yoga practice, which you can be dressed in a skirt, a sweater, whatever you're wearing is perfect for that. I'm just sitting on my couch for the practice. So just so you know what to expect. But when diving into kind of what trauma is in general, and we will focus a little more on vicarious trauma and burnout, although Piper did a great introduction to that, so thank you for that. I like to hone in on what we call our window of tolerance. So just to keep it really simple for the time that we have, our window of tolerance is it's actually what it is our capacity and our ability to cope with life's daily challenges. And one definition of trauma is that it is an event or a series of events. It can be something that happens daily that decreases our capacity to cope. It's something that happens maybe too fast, too soon, or too much. And I like to emphasize that trauma is not the event. It is how we respond to the event. So I might experience something the same as someone else, and I might have traumatic symptoms from that, but the other person might not. So it's also an individualized situation. So I saw a question on the chat right before this around kind of the difference between burnout and vicarious trauma. And I just wanted to kind of emphasize that trauma is not everyone necessarily has trauma. I think a lot of people do, but it's something that happens in response. So if there's something that we're dealing with, whether it's vicarious trauma, so hearing stories from clients or even watching the news, like to be completely real, our window of tolerance might be a little bit smaller. Someone might pass us on the street and brush us, and we might get really angry and reactive. And that's not like a bad thing. Well, maybe it's not a good thing, but that's not to say we're doing something wrong. It's just to say that we might need some more coping skills to move through the challenges of life. I've repeated that a lot, but I'm trying to get the point across. And so with the window of tolerance, like the nervous system, we all have nervous systems, right? We all have the ability to get amped up if we need to, and also relax if we need to. And that's totally healthy, right? If we're excited about something, like right now, I'm excited, I'm a little nervous, I'm a little more in my kind of higher end of my like fight or flight nervous system because I'm excited. But that's a healthy thing because it's just part of being a human. But I'm also able to, in this moment, I have my feet on the floor and breathe and kind of regulate myself down into more of like a rest and digest part of my nervous system so that I feel a little more calm and relaxed and ready to give you all this material and this information. But sometimes when folks are maybe experiencing chronic stress or experiencing trauma or reliving trauma from the past in their bodies, they're not able to regulate. So their window of tolerance, where they're meant to feel like they can tolerate life, is a little bit smaller, right? So they might be on a daily basis more numbed out, zoned out, depressed, or maybe a little bit reactive, overwhelmed, anxious, kind of wanting to just like fight or flee away, even in moments when there might not be a threat. So I think we can move to the next slide. So with exhale to inhale, and with yoga in general, particularly this trauma-informed practice, we're looking at ways to invite folks into the present moment so that they can better navigate life, and so that they can kind of regain some of maybe the joy that they lost from the trauma or from a really high stress, overwhelming job, and even just that balance of work and life. So exhale to inhale, we offer 12 themes. So we have 12-week series that center around participants' healing journey. Our thematic curriculum promotes post-traumatic growth and nurtures healing and empowers participants to make movement-based choices. So this piece around post-traumatic growth, especially going from a slide where we're talking about, trauma, I really like to focus on post-traumatic growth, because no matter what someone is going through, there is this ability, and there's lots of studies that back this up, to show that as much as we can have symptoms from trauma, we can also then heal from that trauma and kind of invite in these qualities of like joy, happiness, connecting to loved ones. And yoga can be part of the journey that helps us to do this. And on the next slide, we're actually going to share the 12 themes. They're not necessarily, actually they are in order, theme 1 through 12. And we just like to share this slide so you all get an idea of this if you're interested in learning more. And we have connection, which is all about connecting to our bodies and each other. And then we also go all the way up to themes around worthiness. So finding that kind of inner dignity, that inner reminder that we're all worthy of self-care and love. And so as you can see, like, again, our mission is around serving survivors. These practices have been beneficial to our corporate partners as well. We've worked with some corporate partners in the work that we've done over the 10 years as well. And folks I do see, I'm going to respond to questions as best as I can as they come. The cost of the program really depends on exactly what you're looking for, whether it's in person, online. And so if you're interested in connecting, I would be excited to connect after around that. So feel free to email me. And so on the next slide, we'll talk a little bit about vicarious trauma. And I am actually just going to read this quote to kind of ground myself and have this offering as a definition. And then on the next slide, I'll expand on it a little bit. So vicarious trauma happens when we accumulate and carry the stories of trauma, including images, sounds, details that we have heard when it comes to, and because of hearing that, it actually comes to inform our worldview. Trauma can be information like that's held in our bodies. And so vicarious trauma is information overload. There's a limit to what we're able as humans to take in and process. The stories of trauma and suffering might start to fill us up and become part of us. And I love emphasizing this. Vicarious trauma is a human response to the experience of coming face to face with the reality of trauma and the difficulties of the human experience. It can slowly shift our outlook and deny us the perspective of a world that exists beyond the traumatic experience. So wanting to empower and emphasize that this is a human response, and especially folks like us who are wanting to help other people and be of support, it's like, it's a response that's actually protecting us in a way, right? But it only serves us for so long and lives in our bodies and then can kind of begin to build up. So that's why we can use moments of self-care to support us. And I think especially over the last couple of years with the pandemic, of a lot of us becoming more aware of what's going on in the world, not to say that stuff that's going on in the world is new, but there has been an increase in what we're hearing and learning about. Then that added to the jobs that we do can just be, like it says here, an information overload. So I'm excited to offer you all a moment to ground towards the end of this presentation. On the next slide, we won't be on this slide for too long, but this might be helpful. When I read and learned about this for the first time, I felt a little bit of relief, because I was like, oh, I'm not just like messed up and I'm not stressed out all the time. Like, I'm actually just responding to the world around me and to the work that I do. Outside of Exhale to Inhale, I also teach other folks. And then I've also worked as a volunteer for other organizations. And so that's where this was coming from for me. But anything that you're experiencing symptom wise is, I will say, is somewhat normal. You're not alone, and there is hope. So we can move to the next slide. You'll get all these slides. With the exhale to inhale methodology, we're really honing in on 5 principles to support individuals in healing. The first one is connection. And when we're able to connect, even if we're right here, we're learning. I'm like leaning in towards you and towards the people that I can't see, but we're learning together and we are connecting. And as Ivy said in the beginning, I love talking a little bit about there was a quote that was read that I can't remember exactly, but around that, like if I am taking a moment to breathe in a room and you're also in that room, that connection connects us and can support each other. So you, even just you at your organization, can be supportive. And so it's just exciting to see like the work at the Family Center and how now this is just becoming more integrated into organizations. The next principle is around safety. So this is just establishing a sense of safety with the folks. Oh, thank you for the heart. I love it that the hearts kind of like fly up on the screen. So I welcome emojis throughout the presentation. But I know I'm in another visual world, but safety comes to us connecting to one another, but also finding safety in the yoga practice and safety with each other, right? So even just this process, and we do this in our classes, we offer guidelines of like, this is what to expect in the class. And also what are some things that help you feel safe? What do you need in this class to feel safe? And some folks might need to say, I might need to step out and get a snack because I didn't eat lunch, right? Anything that can create that sense of belonging, or I might need to ask a question during class, things like that. Simplicity is, yoga goes back 3,000 or more years. And so the practice in itself is very healing. And we'd like to honor the roots of that practice. And so even just coming to sit with our feet on the floor and do a meditation, a simple meditation, we don't have to, transcend and like visualize even, can be super healing. So we like to focus on simplicity. Choice making, and you'll hear this when I offer some chair yoga and meditation, is just some opportunities for you to make choices. When you're in your work life, if you've experienced trauma, you don't always have a choice. Things are coming at you, you're getting information overload. So we like to offer this opportunity for you to really make those choices throughout practice, even if it's something as simple as keep your eyes open or close your eyes. And that last but not least, interoception. Interoception is the ability to understand and feel what's going on inside your own body. That might be the noticing of thirst or hunger, the noticing of like butterflies in your stomach or a pitter patter of your heart, and being able to notice that and respond to it. So this can be helpful if maybe you're feeling like, something happened to you a long time ago, or you heard a story from a client recently, or work is really stressful. And then you get on the subway and you hear a noise and maybe you feel unsafe. The ability to be able to notice that, wow, my heart is racing. And actually right now I'm okay. I'm just cruising on the queue line. And to feel, and I'm in New York, so pardon if that doesn't resonate to everyone, but to be able to pause and notice that and then respond by breathing or whatever it is you do for self-care. That's so powerful. The next slide is my favorite slide. It shares other ideas for self-care. Yoga might not necessarily resonate for you, and that is totally fine. I hope it does. I hope my practice is helpful, but there are so many things that you're probably already doing to support yourself and your community. And so just feel free to look at this, and you'll also have it to take home after these sessions, and look at some of these self-care options and perhaps just notice maybe 1 or 2 that you already do. And I see the chat. So if you'd like to write in a self-care from this chat or from this slide that you already do, or if you'd like to invite in one that's not here, feel free to just type right into the chat box now. And this is just for kind of a community building curiosity on my end, but it's totally optional. Cooking, baking, thank you. Yeah, yoga, manicures. I love that. We have the resources for that. Coloring, thank you. Turning off notifications. That's been a game changer for me. Essential oils. Yeah, awesome. And that can go with like using our five senses, which we'll actually do a little bit in a moment. Nice. Friend dates, meditation, journaling. Thank you. Keep them coming, please. Awesome. Needlepoint. I've been wanting to get into that. Thank you all. And I invite you to just keep them coming. I am going to invite us into a short, about 5-minute digital free Sundays. Oh my gosh, I'm so inspired. A short 5-minute practice.
So Sophia, right before we start that, I just want to do my my exit slide so that people who want to leave us and miss out on your awesome chair yoga can do so, and just have some information before
Great.
we, and I do want to end with your session, because I think it's an awesome way to end today. So just some reminders on our end. Please remember to complete our short post-training survey that will automatically open up after the session, and Audia will also put it in the chat for you if you need to leave early. And in order to watch our previous sessions on demand or to access our written resources, please go ahead and visit our training and resources page. So those were my two little reminders, and if you are able, please join us now for a 5-minute practice.
Thank you, Lara Liz. I appreciate that. And thank you all for being here. So I'll invite you to find a seat. You can sit on a chair, a couch, the edge of your bed. You could sit on the floor and maybe lean against a wall. So whatever seat works for you. I'm sitting on my couch. And just so you know. And so feel free here to, once you find your seat, and if it's possible, have your feet on the floor. If you're on the floor seated, then you can, your legs will be crossed, and it might be the sides of your feet, or your legs might be long in front of you with the heels. But if you're in a chair or something, feel free to even put a pillow or books under your feet so you can really feel that connection. And then just take a moment to sit here. And feel free to close your eyes, or you might keep them open. And just notice for a moment the sensation of your feet on the floor, or maybe even the sensation of your socks around your feet. And I'll invite you, whether you're in shoes or socks, to just give your feet a little movement so you can wiggle your toes. And if that's not happening for you, you might just keep your awareness there. And then feel free to join me. We'll just invite in a moment of movement and then come into meditation. So the wiggling of the toes might continue or it might pause. And then feel free to just lift your hands up and take really gentle fists and start to roll your wrists. And so little movements like this can be invited into any part of your day. If you're like me, you might hear a crack in your wrist, totally normal. Go ahead and go in the other direction and just notice without judgment how this is landing, how this is feeling in your body. Sometimes movement can feel really good. Other times it can feel kind of challenging. It can bring up a lot for us. Okay, now pause that movement and just lower your hands down by your sides or maybe right on your thighs. And feel free now to roll your shoulders up, back, and down. And maybe you do one shoulder at a time, or maybe you do two, just like I'm showing. And you're welcome to continue rolling your shoulders just like I'm showing. Another option is to actually bring your fingertips to your shoulders and then start to roll your elbows forward, back, and around. And so the shoulders are still rolling, but we're just inviting in a little bit more movement with the arms. You're welcome to continue this, or you can go back to arms down by your sides. The choice is yours. Great. Go ahead and go in the other direction just a few times. Great. And then pause that movement and just lower your arms down by your sides, or perhaps even bring your hands to your thighs. Now I'll invite you to join me for a short meditation. You might lean back if you have a chair with the back, or if you have the wall behind you. You could totally even lie down if you have the capacity in your space. Take a moment here to close your eyes, or perhaps just gaze gently straight forward in front of you, or even down slightly. I like to look kind of down at my fingertips sometimes. Here, take a moment without trying to change anything to simply notice your breath. No judgment, there's no perfect breath. Simply notice your breath. And if you'd like, you're welcome to let the next breath rise in through your nose and release out of your mouth. And then for the next minute, feel free to join me in just finding a sense of awareness of your breath. And you can just notice it. So you might simply notice your inhale and your exhale. But if it's helpful, you can add a simple phrase. On the inhale, you might say to yourself, right here. And on the exhale, right now. Inhale right here. Exhale right now. And feel free to continue that breath awareness for the next 30 seconds, beginning now. Right here, right now. You might now bring your awareness to your hands and perhaps just gently wiggle your fingers. And feel free here to lower your arms down by your sides. Reach your arms wide off to the sides if you have room. Maybe even reach your arms all the way up by your ears. And feel free to bring your palms together through the center of your chest, and then rest both hands, if you wish, right on your chest. I'll invite us together to notice one breath in and one breath out. And if your eyes are closed, you might open them and just lower your arms down. And if you have a few more minutes to chill, feel free to rest here. Otherwise, it's been such an honor to be here, and thank you all. I think we're all definitely available for questions via email after this. Thank you.
Thank you so much, Sophia. Getting lots of love there in the emojis. All right. Thank you so much, everyone, for joining us. This concludes our last session of the fall. Please look out for our follow-up email, where you will have information about any upcoming sessions. You'll also get a copy of the slides, contact information for our speakers today, Sophia, Ivy, Piper. Thank you so much for joining us. And please fill out that 2-minute post-session survey. We would really appreciate it. Thank you, everyone. Have a wonderful day.